No one has to tell you which one of these lungs is healthy, right? That unhealthy lung is an absolute mess, invaded by dark, irregular masses that have broken down the typical lung structure, creating chaos where there should be order. That could be what your lungs look like even though you haven't touched a cigarette a day in your life. Scary, right? You see, there's a deadly condition that can silently take root in your lungs, growing and spreading without showing any noticeable symptoms, quietly disrupting your ability to breathe. By the time obvious symptoms appear, it might already be too late. Just listen to these terrifying facts.
Lung cancer is the #1 cancer killer in the United States. It kills more men and women than colon cancer, prostate cancer, and breast cancer combined. Unfortunately, all you need in order to get lung cancer are lungs. So there is a highest risk for developing lung cancer. Those are individuals with heavy tobacco exposure. But really, 20% of lung cancer is caused by non-tobacco exposure, and that includes the environment and genetics.
Lung cancer has earned its reputation as a silent killer due to its ability to develop quietly without noticeable symptoms in its early stages. While most people immediately think smoker when they hear about lung cancer, the reality is far more complex. Here's something that might surprise you. Nearly 25% of lung cancer cases occur in individuals who have never smoked. 15 to 20% of men with lung cancer are non-smokers, while over 50% of women with lung cancer are non-smokers. Some symptoms are pretty obvious, but there are others people often ignore until it is too late. What are the subtle symptoms of lung cancer that most people miss? Recognizing the symptoms of lung cancer can make all the difference in a person's journey with the disease. When symptoms like a persistent cough, chest pain, or shortness of breath are noticed early, it becomes easier to diagnose the cancer before it spreads. Early diagnosis means doctors can begin treatment sooner, which significantly improves the chances of survival. In 2006, Christy, a 38-year-old woman, began experiencing troubling symptoms: fatigue, shortness of breath, chest pain, back pain, and a persistent wheezing cough. These, she would later learn, were 5 key symptoms of lung cancer. Despite being a lifelong athlete with a background in basketball and track and having never smoked, she found herself struggling to breathe even after walking up a flight of stairs. Concerned, she decided to consult her doctor. Her primary care physician initially found no obvious issues. Heart and spine exams came back normal, and tests for asthma were negative. The doctor prescribed medication and recommended a follow-up in 30 days. However, just days later, an X-ray technician identified several spots on her lungs, prompting further investigation. Over the next 3 months, she underwent extensive testing at 5 different hospitals. In September 2006, her doctor called her in to discuss the results. Accompanied by her husband and family, she received the devastating diagnosis: Stage 4 lung cancer. The disease had already spread to both lungs and her neck and included a tumor the size of a golf ball in her chest. Doctors informed her that the prognosis was grim. She had only a 2% chance of survival, with most patients in her condition succumbing within the first year. The news was overwhelming, and the family was left grappling with the reality of what seemed like an impossible situation. While she would later survive cancer after a 13-year fight, this story shows how paying attention to small but persistent symptoms can have a big impact. By acting quickly, Christy improved her chances of survival. Here's a sobering reality about lung cancer and why it is so dangerous. You see, by the time many people find out they have it, the cancer has already spread to other parts of their body. This helps explain why lung cancer claims more lives than any other type of cancer worldwide. But there's hope, because catching it early can make a massive difference in survival. Let's break down the numbers. If lung cancer is found before it spreads, doctors call this localized. About 60% of patients will survive at least 5 years. But when the cancer has spread throughout the body, that survival rate plummets to just 6%. The problem? Only about 16% of cases are caught early enough to have a better chance of survival. A cough that won't go away is one of the most common warning signs of lung cancer. Most people might assume it's just a lingering cold or seasonal allergy, but it's worth paying attention to if it lasts for weeks or even months. Even worse, the cough may gradually worsen, becoming more frequent or producing mucus. This is why paying attention to your body's warning signs is crucial. Don't ignore symptoms like a cough that won't go away, losing weight without trying, or chest pain that keeps coming back. These might seem minor, but getting them checked out quickly could save your life. Do you ever find yourself struggling to breathe, even during light activities like walking up a flight of stairs or doing housework? Shortness of breath can often be mistaken for aging or being out of shape, but it could be an early sign of lung cancer. This symptom occurs when a tumor blocks or narrows airways, or when fluid builds up in the chest. Chest pain is also another potential warning sign of lung cancer, even though it is usually associated with heart problems. The pain may feel like an ache, pressure, or stabbing sensation, especially when coughing, laughing, or taking a deep breath. If you notice chest pain that doesn't seem connected to an injury or illness, it's important to get it checked out. While losing weight without trying can seem like a flex or be attributed to a good metabolism or genetics, it can often be a sign that something is wrong with your body. Rapid, unexplained weight loss may be an early indicator of lung cancer. This happens because cancer cells use up energy in your body, causing weight loss even if your diet and activity level haven't changed. Have you ever noticed someone's voice becoming hoarse or raspy over time? If you have, you need to get them checked out. Persistent changes in voice tone or pitch could be a sign of lung or throat cancer. A tumor pressing on the vocal cords or nerves can cause this symptom. If voice changes last for more than a few weeks, you definitely need to see a doctor as soon as possible. A more obvious sign is coughing up even small amounts of blood, which can be a frightening experience, and it should never be ignored. This symptom, known as hemoptysis, is one of the more serious warning signs of lung cancer. It indicates that there may be damage to lung tissue or blood vessels, which needs immediate medical attention. If you or someone you know keeps getting sick with bronchitis, pneumonia, or other respiratory infections, it could be a sign of something more serious. Tumors can block airways, making the lungs more vulnerable to infection. Recurring illnesses like these are often a clue that something is wrong. If you see the warning signs, don't panic. There are things you can do and measures you can put in place to protect yourself and reduce your risk. Well, if you smoke, quitting is one of the best things you can do for your health. Smoking is the leading cause of lung cancer, but it's never too late to stop. Even after years of smoking, quitting can reduce your risk significantly. Avoiding secondhand smoke is equally important, as exposure to it can also increase your risk. Another factor many people fail to consider or worry about is radon gas. If you haven't, you should probably test your home for this gas. Speaking of radon, this invisible, odorless gas is actually the second leading cause of lung cancer in the United States. It is responsible for about 21,000 deaths each year, which is why testing your home for radon is so important. You can't see or smell it, but this radioactive gas could be seeping into your house right now. The good news is that testing for it is simple, and if levels are high, there are ways to fix the problem. Radon is a naturally occurring radioactive substance that can enter your home through foundation cracks. It is the second leading cause of lung cancer after smoking. You can easily test your home for radon immediately, as it is quick and affordable. If high levels are detected, take action to reduce your exposure and protect your health. Aside from testing for toxic substances like radon gas, taking care of your body in general helps too. Habits like eating healthy foods and avoiding harmful chemicals when possible will go a long way. These habits won't make you immune to lung cancer, but they will surely help keep your body strong and healthy. While you can't control outdoor air quality, you can take steps to protect yourself indoors. Avoid spending too much time in heavily polluted areas, and consider using air purifiers at home to improve indoor air quality. Regular exercise can also help improve lung health and overall well-being. While these measures won't eliminate the risk of lung cancer, they can strengthen your immune system and help your body fight illnesses. Also, if you notice that lung cancer runs in your family, you may be at higher risk. Talk to your doctor about your family history and ask if genetic testing or early screening might be right for you. Screening for lung cancer is another way, in fact, one of the most effective ways to catch the disease early. Low-dose CT scans can detect lung cancer in its early stages, even before symptoms appear. Screening is especially important for people at high risk, such as long-term smokers or those with a family history of the disease. The disconnect between what people know about lung cancer symptoms and what they should watch for helps explain why so many people die from this disease. But there's good news. Knowing what to look for and acting quickly when something seems off can make a huge difference in catching the disease early. The numbers may paint a stark picture. Lung cancer kills more people than any other type of cancer worldwide. But don't lose hope. Modern medicine has given us powerful tools like special CT scans to spot lung cancer earlier than ever. The key to turning these statistics around is education and awareness. The more people understand about lung cancer, its risks, warning signs, and the importance of screening, the better equipped they are to protect themselves. Knowledge really is power when it comes to fighting this disease. So, pay attention to your body and take action if you notice any of the warning signs mentioned earlier. A persistent cough, chest pain, shortness of breath, or other unusual symptoms should never be ignored. It's better to see a doctor and find out it's nothing serious than to miss the chance for early detection. So, what benefits do you stand to gain from early detection? Anyone can get lung cancer, but you can take steps to lower your risk. The most obvious one? Don't smoke and avoid breathing in other people's smoke. If you're already a smoker, quitting is hands down one of the best things you can do for your health. It's never too late to stop. For people with higher risk factors, like long-term smokers or those with lung cancer in their family, there's another option: screening tests. These special CT scans can spot cancer before you even notice symptoms. Finding cancer this early opens up more treatment options and gives you a much better chance of beating it. When lung cancer is detected early, it can lead to a much better outcome. One of the most important benefits of early detection is increased survival rates. According to medical studies, the 5-year survival rate for lung cancer detected at an early stage is around 60%, compared to just 8% when the cancer is diagnosed after it has spread to other parts of the body. Early detection also improves a person's quality of life. When cancer is caught early, treatments like surgery, radiation, and chemotherapy can be less invasive and more effective. Patients may experience fewer side effects and recover faster, allowing them to return to their normal lives sooner. However, when lung cancer is diagnosed late, the long-term repercussions can be devastating. Late-stage cancer often requires more aggressive treatments, which can lead to significant physical and emotional challenges. For example, patients may need months of chemotherapy or radiation, which can cause fatigue, hair loss, and other side effects. The emotional toll of facing an advanced cancer diagnosis can also be overwhelming for patients and their families. One of the best ways to avoid these long-term complications is by taking proactive steps to protect your health. Regular checkups, screenings, and leading a healthy lifestyle can lower the risk of serious illnesses. Eating nutritious foods, staying active, and avoiding harmful habits like smoking are simple ways to stay healthy. Additionally, paying attention to small changes in your body, like unusual pain, fatigue, or other symptoms, can help you catch potential problems early. Being proactive empowers people to take control of their health and avoid unnecessary suffering. Spreading awareness about the importance of early detection and proactive health measures can save lives. When people learn about the benefits of early screenings and early warning signs, They are more likely to visit their doctors and get tested. For instance, encouraging loved ones to schedule regular checkups can help them detect health problems before they worsen. Sharing stories of how early detection has saved lives can also inspire others to prioritize their health. By focusing on early detection, taking steps to prevent future health problems, and encouraging others to do the same, you can create a healthier, more informed community. These efforts will not only save lives, but also improve overall well-being, showing the power of awareness and action. Every step you take toward early detection and awareness can save lives. When you share information, like this video, about the warning signs and encourage regular screenings, you empower people to take control of their health. It's a reminder that small actions, like visiting a doctor for a persistent cough, can lead to life-changing outcomes. Lung cancer is a formidable disease, but it's not unbeatable. Through education, prevention, and early diagnosis, people like Christy live longer and healthier lives. A future where lung cancer is caught early, treated effectively, and no longer feared is very, very possible. If you've enjoyed watching this video, hit that like button and subscribe for more expert health tips and life-changing advice.